New nurses, looking at your skin is one of the most important report cards for your patient's circulation, mobility, hydration status, and their care overall. So, of course, when we look at the skin, we'll look at the skin color. Is it within normal limits? Is it pink or skin flesh tone? The temperature, is it warm, cold to the touch, or hot? Is it intact? Mean, are there no open areas? Is it pale? Does it have moisture, like diaphoretic, um, or discharge of any area? The turgor, when you pinch it, does it snap back into place, or does it stay or remain tinted? Um, and then the integrity again, is it intact, compromised, or um, open? Any bleeding present. So then also you want to check over your bony prominences, and this is like most important in patients that we consider total care who cannot reposition themselves or shift positions. So you're going to look at even like the ears, the breakdown, the back, the elbows, both elbows, their ankles, the sacrum area. I think those are generally the areas. Yeah, the heels, elbows, ears, the back of the head, just laying flat on the head, anywhere the body actually just makes contact with the bed and they're not able to reposition. You want to look for skin breakdown. And really, you can actually pad it with the Mepilex, which is like that bordered pressure dressing, and you'll pad that site just to give it like cushion, or and then also reposition every 2 hours to make sure it's not the skin is not breaking down on that site. For skin, you're also going to look for any type of drain. So whether it's a Jackson Pratt drain, um, a bulb drain, any lines or tubings that are impairing the skin, you'll look at that. And if it's a drain or dressing IV, look at the dressing, make sure it's clean, dry, and intact. Look underneath the dressing, make sure the skin is not red. Even colostomy bags, make sure that the skin is not red, broken down. It doesn't look angry. No extra discharge or moisture at the site. Edema. So we talked about edema in the circulation, the cardiac assessment, but edema as well generally starts at the ankles or lower extremities and can travel up. You can just be fluid overloaded. So we grade it with 1 + 1, 2, 3, 4, and we say is it pitting or non-pitting. What else? You look at the skin. Is it taut? Like it's a lot of it's very tight where it can't be pinched, or is it very loose? Is it weeping where sometimes they have edema and now it just pours out of the skin, so it can have like drainage? Is it shiny? Is it dull? You think about peripheral arterial disease or peripheral vascular disease. You look for any rashes, any bumps. You can even notate if they have tattoos, any petechiae. So you may think of like fat embolism, or allergic reactions. So proper skincare, of course, you'll turn and reposition your patient, or even prompt them to turn themselves if they're independent. You keep the skin clean, dry, and intact. For incontinence care, you may apply a barrier cream to prevent skin breakdown. You offload the heels, which means like even pillows underneath the calves to get the heels actually off the bed and floating, or even those boots, just to make sure that the heels do not touch the bed. Use moisturizers when needed. Lotion should be good, or a barrier cream again for incontinence care. So that's skin assessment.